the study found an association between elevated uric acid and new onset atrial fibrillation, or AFib. And it's interesting because uric acid is a test marker that will run if we're concerned about gout in a patient. In patients with gout, uric acid is lab high, okay? So that is tied to gout, but it's also possible to have lab high uric acid and not have gout, okay? So I can't run uric acid on you, get a lab high uric acid number, and just assume that you have gout. You know, we have to, again, treat you as a unique individual you are and figure out, is there gout or not? And so if it's not gout, elevated uric acid can indicate what's called inflammasome activation, which inflammasomes are structures built in your cells that start fires inside your cells. It's intracellular inflammation. And that is a part of gout. That is a part of hypotension, so low blood pressure, not high blood pressure. And this new study from the American Heart Association shows that high uric acid is associated with AFib, new onset AFib. And so atrial fibrillation, if you're not aware, drives tachycardia and heart racing, and it can be so fast that it's driving anxiety and you think you're going to die. So if you've got new onset AFib and they've ruled out other things and they're saying, hey, we don't know what it is, well, here's hot off the press. They're finding that high uric acid may be the cause. And in a typical cardiology visit, they're not running a uric acid in your labs. And so you may want to request that they run a uric acid, and it's like $3. So should be easy to do. But they discovered this in Sweden. They looked at the Swedish study at a total of nearly 340,000 people. And they found that compared to the lowest uric acid level, if they break the uric acid range into quartiles or quarters, okay, the lower your uric acid level is, the lower your risk of new onset AFib. The higher it is, the higher the risk, where the hazard ratio for the top quartile of uric acid is 1.45, or people with high uric acid have a 45% higher risk of developing new onset AFib. And that number, if we go down to the table in the study, it shows you how the quartiles are broken down. And the highest quartile was, that number was 366.5 U-moles per liter, which is not how we measure it in the US. In the US, we measure it as milligrams per deciliter. And that U-moles per liter converts to 6.16 milligrams per deciliter, which would be, depending on the lab you're running it on, would be either lab high or functionally high. If you're a gout patient, we want uric acid levels below 6 in gout patients. Okay, so that would be considered, a 6.16 would be considered high for a gout patient. It's also high, if you don't want to develop new onset AFib. So then the question is, well, what drives uric acid up? The most common driver of increased uric acid in the diet, or in the typical American life, is fructose. So if you have a friend or family member struggling with heart racing, tachycardia issues, and they haven't been diagnosed with AFib yet, and they're going in to be assessed, maybe have them add a uric acid to their labs. If they've got recent diagnosis with AFib, then check out their labs, and if they didn't have a uric acid run, maybe have them go back and have that run and address that, because the drug they give for AFib, Eliquis, will do nothing to lower your uric acid. So if uric acid elevation is the reason behind your AFib, and you're taking a drug to lower the symptoms but not address the cause, then you're going to be on that drug forever, or until they either give you an ablation or they figure out, hey, your uric acid was high. The odds of them finding out the uric acid is contributing are very low, because unfortunately it takes 17 years for the research to make it into med school and textbooks and clinical practice. So this study just came out in 2023. So don't wait for medicine to catch up. Go ask for the test.